8 Republican senators say they are not sold on the health reform bill in its current form. Arkansas Governor Mike Huckabee joins us now. Former governor, I should say. Former Governor Huckabee, welcome to the program.
Thank you very much, Stuart. Good to be with you.
Governor, I don't see how the Republican Party can walk away from this without getting something done very, very soon. You just can't walk away, can you?
Well, you can't walk away, but something that is worse than not getting it done quickly is getting it done wrong. And I think that they could be on the pathway to making some major blunders, because what we basically have, if this were a fairy tale, it would be Goldilocks and the 3 bills: Obamacare, the House version, and the Senate version. And at this point, none of them are just right. They all are either too hot, too cold, and in part because I think both sides are looking at this trying to make it an ideological bill rather than a practical, pragmatic bill. This ought to be a vertical issue. Better or worse, not horizontal, left or right, and that's the mistake.
But it's about politics. That's what's going on here. I mean, you can't...
It's very much.
You simply got to have something done because 2 reasons. Number one, Obamacare is collapsing. What are you going to do? Walk away from this as it collapses? What happens to people then? And number 2, the Republican Party has to show that it can govern. That's what we put them in power for. You got to do it.
Couldn't agree more, Stuart, but here's the question. What is the end game here? And if the end game is to save money, then the Republicans might be on the right track. But that's not the end game that Donald Trump campaigned on. And it is not the end game that Americans care most about. They want access to affordable and reasonable, realistic health care. I think Republicans are going to have to suck it up and say, this isn't going to get a lot cheaper. It can't. It won't. You have an aging population, 10,000 seniors a day going into retirement. You have people who are living longer than they were ever expected to live. 80% of the health care costs are all about chronic disease. You have Medicaid budgets that are runaway because you don't allow the states to put cost controls on them, like copays, deductibles, and premiums, which would help control utilization. So we're trying to somehow fix something without the tools to fix it. This could be done, but I'm not seeing the elements that would make it where it's workable.
If it's not done this week or very soon, even by August, if it's not done, I don't think you get tax reform done. Do you?
You may not. I think tax reform should have been done first.
Yes, but
I think they should have done it in the last week of January.
I mean, look what we're facing here, Governor. I mean, Obamacare is collapsing. It's gone. It's walking away. I mean, this thing is dead. We have a Republican Party that can't do what it said it was going to do. And now we find, well, maybe we won't get tax cuts either. I mean, this is an impossible situation.
Well, what they're still failing to do is to remove this from the horizontal left-right argument, which is the reason you've got some moderate senators who won't support it because it's not liberal enough. You've got conservative senators who won't support it because it's not conservative enough. And you need to take it out of the whole left-right issue and make it an up-down issue. There are some fundamental things that would really improve the health care access for people. It would get rid of Obamacare, but I'm not seeing it in this bill. There's some good elements, and I applaud them for that. But I want to go back to the point. You've got to define what your end game is, and this bill doesn't do that. It simply says we're going to cut the cost, we're going to take away the tax burdens, we're going to, tweak some things.
No,
that's not what fixes Obamacare.
No, sir, if you I know we're both laughing here, but this is serious stuff. Look, if you take away the mandate on the individual and the mandate on the employer, that's not tweaking. If you take away 21 of 22 Obamacare taxes, that's not tweaking. Not tweaking at all. You've destroyed the essence of Obamacare. Go for it.
That's fine. But how many people out there in the states who now have been enrolled in Medicaid-related programs are not going to be able to access them? Stuart, look, you and I don't philosophically disagree with this, but where I think that we're having a challenge is that unless you give some cost controls on the Medicaid program, it will bankrupt every state. And the feds basically in the Senate bill are washing their hands of Medicaid and saying to the states, good luck, we're going to give you a sliding scale less money, but you still have all the responsibilities, and we're not going to give you the level of flexibility. I guarantee you every governor in America would take less money if they were given great levels of flexibility to meet the needs of their individual populations. That is a real fix. It's not cosmetic. That's genuine.
Okay, let's agree to differ like this. There's going to be an enormous amount of horse trading and sausage making this week.
Yeah.
But at the end of this week, I say it's better to do something rather than do nothing. And I think we're in disagreement about my last point. Last 10 seconds to you, Governor.
Well, I think we do disagree because the only thing worse than not doing anything is doing something that makes it worse, that actually creates for the Republicans not just a health care problem, which I think it could, but also creates for them a political problem where even their own base begins to reject them. They don't need to be in a hurry. They need to be making sure that they're diligent to do it right, not just do it quickly.
Okay, so long as we end on a smile, we'll be all right.
We do.
Governor,
Still my friend.
Yeah, oh, yes, sir. Got it. Thanks very much, sir. Appreciate it.